So here we have our ventilator. It's a Mindray ventilator, and the first thing you want to do is connect your ventilator to oxygen port. Then switch on your ventilator. So before you start using your ventilator, you should do a system self-check, which already has been done to our ventilator. Then now we are going to discuss about the different modes of ventilator and what we set for every mode. So with me, I have my test lung. This is like a lung. This is what we are going to be using, not a real patient. Okay, so this is our ventilator, and down here we have the modes of ventilation and the settings that we are going to be using. To begin with, we have our AC mode, that is assist control, and we have assist control volume cycle. So the first thing you want to set is your FiO2. We've talked about the FiO2, and the FiO2 is the concentration of oxygen. The normal FiO2, that is room air, is 21, but for a ventilated patient you want to increase that. So I can start with 80%. The next thing, because it's volume cycle, I want to set the volume that I want the patient to have. And the volume, we set 8 mils per kg, assuming my patient is ideal body weight. My patient's ideal body weight is 50, so 8 times 50 will be 400. So I'm going to set at 400. Then next, I want to set my respiratory rate, and you can choose the respiratory rate that you want to choose. I can choose to have 14. The next thing I want to set in this is the inspiratory time. So this one you can choose. If I have set 12, or let's say we've set 10, so between breath to breath we have 6 seconds. So you can choose how many seconds you want them to take when they are taking in the breath. How many seconds do they take when they are taking out the breath? That is the time that we set here, and that will be dependent on the condition of the patient and other settings. The other thing is the PEEP, that is the positive expiratory and expiratory pressure. The normal PEEP of a patient is 5. So depending on your patient, you want to at least have the normal PEEP. So assist control is on. The next thing is the trigger, the sensitivity of the patient, to give the sensitivity that you're going to set so that it triggers the ventilator to give a breath. Then after that, you can now start your ventilation. So we've begun our ventilation. So when we begin our ventilation, we notice there are 3 curves on the left side of our ventilator, and we have some parameters that we are going to be monitoring on this other side. So the first curve is for the pressure. That is the pressure that is being used to deliver the volume that we picked for our patient. The next thing is the flow rate. That is the flow by which the volume that we are giving is being delivered. Then the last one is the volume that is being inspired. That is what we have here. Then on this other side, what we have is first the P peak, that is the pressure, and this pressure is the pressure from the tubings all the way to before we get to the alveoli. So the normal peak pressure should be less than 30. So if we have high peak pressures, we want to think about secretions, we want to think about our tube being dislodged or if there's any obstruction. The other thing we have down here is our minute ventilation, and the minute ventilation is the respiratory rate times the tidal volume. This is the tidal volume that our patient is making. Then it tells us about the FiO2 and what we are giving to our patient per minute. So that is for AC volume cycle. So we have also AC assist control pressure cycle, and what will be given, the type of breath in this case will be a pressure control. So what I'll be setting is, again, the universal setting. I will be setting my FiO2, I'm setting my PEEP, my respiratory rate, the time of inspiratory, the trigger, the slope, and then instead of setting the volume, the tidal volume in this case, what we will be setting will be the pressure. So what we are cycling in this mode is the pressure, and then what it gives us is the volume. Then we have other